So what facials, like what's newest on the market for you guys?
Okay, so I'm still recovering from my SkinPen last week.
Glowing SkinPen.
So I did a PRX facial,
Okay.
which starts with like a peel, and then she used the SkinPen, which is like micro needling. So it's like you know get jabbed all over, which I thought would hurt, but it didn't. She numbs you a little before, and then she finished with another PRX peel. So it's like a non-peel peel, and I'm gonna produce collagen, and I'm gonna look at least 36. So
Yeah.
boom.
And
I thought you
recovery
were
time.
36.
I'm 40.
Oh.
I'm fighting it. Yeah, it's fine. But then we have hydrofacials, cryofacials, standard facials,
Okay.
peels, masks, all the fun stuff.
Okay.
So yeah, you can get your glow on.
So you can like come in, do a cryo session, get a facial, get adjusted next door, get an IV drip.
Yeah.
I mean, this is the reason I haven't been in yet because I'm like, I need a whole day.
So that's what's actually funny is people are dated Thrive and they're like, I don't know where to start. And I'm like, oh, there actually is a day pass. That's hysterical. There is a day pass. You can come in and try 3 things. And it's like $69. You can do the
Are you
red
kidding
light.
me?
You can do the
I've tried it.
sauna. You can do the whole body cryo. You can do all the stuff.
I know actually.
Did we get you in the cryo chamber?
Yeah. I did
Oh.
3 minutes.
The cryo chamber is like the best.
Yeah. You got to
Okay.
get a cold plunge in there next.
Okay, no, because
I
whole
know
body
it's the-
cryo is actually, it's more effective. Don't tell that to the cold plunge people because they get real pissed about
Yeah.
it. But it gets
Yeah.
colder than a cold plunge, right? So it's between negative 160 and negative 220. So you're in there for 3 minutes. Your head is also in the chamber, which is hard to do in a cold plunge, but most of your cold receptors are actually on your head. So you're in there, your body's kind of like, wait, what's happening? And it helps to reduce inflammation. It helps to burn calories, like up to 800 calories in a session. What?
in 3 minutes.
In 3 minutes, because it stimulates thermogenesis. So your body's like, oh my gosh, I'm super cold. And then it has to work really hard to bring your body temp back up. It helps
That
with
is
sleep.
crazy.
You get a dopamine reaction. So it does a lot of things. But like postmenopausal women who did it twice a week for 6 weeks lost an average of 5% body fat.
Wow.
Yeah. So there's science.
Wow.
Yeah.
That's big.
So it's incredible. But if you do the sauna first, you can burn like 400 to 500 calories in there. And then you can go into the whole body cryo machine.
So you have
And
a
then-
sauna in there too.
I have 3 saunas. I'm sorry.
So okay, I gotta back up.
Yeah.
I'm trying to get the whole picture. Synergy Health is
Uh-huh.
4,500 square feet.
Yes.
Thrive is
2450.
okay. So it's
Separate building.
a separate. no,
Separate-
I understand that separate building, but I'm thinking, okay, sauna, facial rooms. Like we've got, it's like a vacation sounding.
Oh, it is.
Like for anyone interested in self care.
Oh, yeah. No, you really could go in. You know, if you have 5 minutes, great. You can go in and get a quick vitamin booster or do the whole body cryo. If you have 3 hours, I mean, you can just go in. You
Spend all day.
can drip, drip, hooray, do all this stuff.
Hooray!
Yeah.
Do you have merch that says that?
Actually, yeah.
Drip, drip, hooray! Everybody loves Naples.
But my favorite hashtag trademark on this one,
Okay.
the Detoxarita. That would be our hangover drip. Yeah,
Oh.
you're welcome for that.
Oh my god.
Mm-hmm.
Cool.
Yeah. So,
Natalie doesn't need that. She's doing 75.
Listen, I'm on day 17 of 75 hard.
that sounds terrible.
It-
I don't know what it is.
It's actually something I'm enjoying, which I'm shocked about.
Uh-huh.
But the point is, I'm not drinking.
Okay.
And the last day, yes, it's on the calendar, April 27th. So I will be in there April 28th because I'm sure I'm going to need some detoxaritas.
Uh-huh.
So
Yeah.
let's get back to Synergy real quick because I've been there. I guess I'm a patient, I'm a client. I go in there.
You said it, not me. No HIPAA violation there.
But I go in there, I get adjustments,
Mm-hmm.
spend some time in the massage chair.
Oh, yeah.
It's not just basically a place where you go and get your back cracked. You guys actually take the time to find out what's going on with your back and kind of try and figure out how to work it. You're not just
That is the goal.
Yeah.
Yes. So when patients come in, like I'm always telling them, you know, plan A is great. We can do some adjustments on there and see if that's making a difference. But there's always a plan B, C, D. So we're not solving all of the world's problems, you know, one adjustment at a time. But, you know, if that's not helping, great. We have massage. We can do dry needling. We can do trigger point injections or PRP. We're probably the least expensive PRP in town. So that's platelet-rich plasma. We take your blood, we spin it down, and we inject it into a joint. And there's still places charging like $500 for it, and we charge like $175. So it's reasonable to go in and actually make a difference, because that's a therapy that can actually help, people who are worried that they're going to need surgery. I've had patients go, okay, I did 3 of those and my shoulder feels great. I don't think I'm going to need surgery now. It might not last forever, but it's at least allowing them to, wait a little longer on there.
Sure.
So we've got a lot of fun stuff in there, but also a great group of professionals. So we have 2 doctors of physical therapy, there are 4 chiropractors, a nurse practitioner, an MD oversees everything, and then I think we have 15 massage therapists. So
Yeah, so you can get a full massage,
yeah,
30 minutes, 15 minutes, an hour.
yeah. But we have like amazing people that all bring a different perspective. And so, if I don't have the answer, Dr.
Right.
Kevin, Dr. Lori, Dr. Avalon might, or, a lot of times we find that I'm working on loosening up the joints, but somebody really needs some of that rehab component. And so they're going to physical therapy, or they might need a joint injection. So we have people that are the frequent flyers that come in and do all the things. And we have
Yeah.
people that are like, I just want a massage, or I just want a quick injection, or I just
Yeah.
want to do some PT, and that's fine too. So,
How did you go about growing this tribe of people and all the variety?
it was painful.
Okay.
I'm going to be writing a book called All the People I Fired, because there
Yes.
have been a few of those over the years.
Okay.
I have some stories. But, when you find somebody that's really great and you kind of connect and you can see that they're interacting with your patients, and I feel confident enough in their level of care that I'm okay with them seeing my patients, because I'm very
Yeah.
no, they're mine. I get very protective of that. Once you know that, then it's like, what can I do to make sure you're happy and you stay forever? And so we really try to make sure that we're, creating a culture in Synergy Health where people want to stay there, and they want to stay there till they retire or they, move away. And that sometimes happens, and that's sad. But for the most part, most of our staff members have been there, 3 years, 4 years, 6 years. We had somebody there that was almost there for 8 years, and then she decided to have kids and left. I know. So I'm waiting for her to come back, because
Yeah.
she'll be back.